Hi and welcome to our channel. Today's video is all about the IV to PO switch. So let's get started. The IV to PO switch, also known as intravenous to oral switch, is a change in antibiotic administration from the intravenous to oral route. This practice is commonly implemented in healthcare settings when patients demonstrate clinical improvement and can safely tolerate oral medications. In the case of severe infections, most patients who can effectively absorb oral medication but initially require IV therapy can safely shift to oral therapy within 48 hours. This rapid switching offers several advantages such as reduced costs and ensuring patients receive antibiotics at the correct time, saves valuable time for medical and nursing staff, patients experience reduced discomfort, enabling the possibility of early discharge. The risk of adverse effects and its consequences associated with IV therapy is potentially minimized. In considering the early switch to oral therapy, there are important factors to review at the 48 hours mark. These considerations include, firstly, the functioning of the gastrointestinal tract, ensuring that it is capable of adequately absorbing oral medication. Secondly, assessing clinical stability, which involves being afebrile, mean without fever, for at least 24 hours, and observing the normalization of white blood cells (WBCs) count. It is important to note that the eligibility for IV to PO conversion may vary depending on specific factors such as the severity of the infection, patient characteristics, and individual treatment guidelines. The exclusion criteria for the switch to oral therapy are as follows. Patients with an unreliable response to oral medication, such as those undergoing continuous nasogastric suction, having short bowel syndrome, experiencing motility disorders of the gastrointestinal system, or showing unresponsiveness to previous oral therapy. Patients whose disease state does not support oral therapy, including conditions like meningitis and endocarditis, where IV therapy is necessary. Patients in a septic shock state require continued IV therapy for stabilization, and infections that may require weeks of IV therapy and high-risk infection demanding prolonged IV therapy. These exclusion criteria help identify patients who may not be suitable for the immediate switch to oral therapy, ensuring appropriate treatment decisions. When considering a switch from IV to oral antibiotics, it is essential to ensure that the antibiotics have a suitable oral formulation available and are well absorbed after oral administration. These antibiotics include ciprofloxacin, clindamycin, fluconazole, levofloxacin, linezolid, metronidazole, trimethoprim and sulfamethoxazole, and voriconazole. And this is the chart for switching IV dose to equivalent oral dose. It may vary based on the strengths available in your country. Thanks for watching. If you found this video helpful, please like, share and subscribe. Join our community for more valuable contents.